Imagine an exercise that requires no steps, no treadmill, and almost no space. Squeeze a hand grip or hold a wall squat for repeated intervals. It sounds too simple to change resting blood pressure, yet the pooled data are surprisingly strong. A 2026 meta-analysis found average reductions of about 5.4 millimeters of mercury systolic and 2.7 diastolic after hand grip training. A separate randomized workplace trial reported even larger systolic changes after hand grip and wall squat programs. Those numbers deserve attention, but not a reckless do-it-yourself maximum effort hold. The newer meta-analysis assembled 31 studies with 905 participants across normotensive and hypertensive groups. Isometric hand grip protocols usually involved repeated submaximal contractions rather than squeezing as hard as possible. The pooled systolic reduction was 5.38 millimeters of mercury, and the diastolic reduction was 2.71. Both were statistically significant, but heterogeneity was high. That means results varied substantially between studies. Baseline pressure, medication, supervision, intensity, equipment, and program length all shape what that average means for an individual. A drop of 5 millimeters is visually easy to underestimate because blood pressure varies from moment to moment. The meta-analysis is about the change in resting measurements after repeated training, not the pressure response during a hold. Isometric exercise can temporarily raise blood pressure while muscles contract, especially with larger muscle groups, high intensity, or breath holding. The training adaptation and the acute response point in different directions. That is why the useful chart shows the long-term average reduction alongside a bright warning. Do not perform maximal holds or use a breath-holding strain as the protocol. The workplace trial randomized 77 unmedicated adults with hypertension to hand grip, wall squat, or control. For 12 weeks, the exercise groups completed 4 repeated holds 3 times per week. Mean systolic pressure fell by 11.2 millimeters in the hand grip group and 12.9 in the wall squat group, compared with almost no change in controls. The program was supervised, progression was structured, and every participant completed both phases. No adverse events were reported. That is encouraging feasibility evidence, but it is not the same as handing every viewer one universal wall angle or grip intensity. The trial then reduced training from 3 sessions per week to 1 for another 12 weeks. The systolic benefit was largely maintained, especially in the wall squat group. This finding is useful for maintenance, but it is often misread. The study does not show that one weekly session creates the original reduction. Participants first completed 12 weeks at 3 sessions per week. It also used office measurements rather than 24-hour ambulatory blood pressure, and attention from supervisors may have supported adherence. A dramatic within-group change can be real while still needing replication in broader settings. If blood pressure is a goal, start with measurement and medical context rather than a viral challenge. Use validated equipment, know whether your clinician has placed exercise limits, and avoid breath holding. A wall squat loads a large muscle mass and may not suit knee or balance problems. Hand grip needs a way to estimate a submaximal intensity. Dynamic walking, resistance training, sleep, diet, medication, and stress management remain part of the larger picture. Isometric work is a compact option, not a replacement for treatment or a reason to stop medication. The evidence-based takeaway is that repeated isometric training can reduce resting blood pressure by clinically meaningful averages. Hand grip has the broader pooled evidence. Wall squats produced a large change in one supervised trial. The programs use structured intervals over weeks, not one heroic hold. Maintenance may require less time after the adaptation is built. If this fits your health and movement capacity, it is a promising tool to discuss and test safely. The headline is not, "Hold your breath against a wall." It is, carefully dosed, repeated muscle tension can change what happens when the body is resting. Blood pressure readings also depend on cuff fit, rest, posture, talking, and time of day. A training experiment is only interpretable when measurement is standardized. One unusually low reading after exercise is not evidence that a program has worked, just as one high reading is not a reason to panic without proper assessment.